Dear friends, I am Dr.V Chandra Mohan, Urologist, Managing Director, Preeti Urology and Kidney Hospitals. We have 3 branches in Hyderabad, that is at KPHB, BHEL and Kondapur. This operation theatre is at Kondapur, which is happening part of the city. In this hospital, we have installed recently the robotic technology in the field of urology and surgery and gynecology. This robotic technology is not new thing. For last 20 years, the Western world is already using the robotic technology. But the uniqueness of this robotic technology, which is called SSi Mantra. This is an innovative idea by Dr. Sudhir Srivatsava, who is cardiac surgeon from India and went to USA and practiced for 30 years as cardiac surgeon, and then he pioneered the robotic surgery in cardiac surgery. He subsequently came to India and then he wanted to make a robo which is affordable to many of the surgeons as well as the Indian population. That is nothing but this SSi Mantra Robo. When I purchased this robo, the reason as an individual urologist with a team of 250 employees, when I purchased this robo, I was worried whether financially I will be viable or not. Naturally, I will be looking for a less costly robo, but at the same time can give all the facilities which all other Western country robos are giving. After certain inquiry, I have purchased this. In this robo, I am giving an introductory video. This introductory video consists of what is robotic technology in surgery, what are the various parts of the robotic technology, how the patient is can utilize this facility, how it works basically, and along with some video clips. Now coming to the first thing is surgeon command center. The most important is in any robotic technology in the world, primary brain is the human being. We human being, we the surgeons will operate on this surgeon command center, SCC, surgeon command center. In this surgeon command center, they will give a chair, and most important part of this robotic system is it is open console system. The other famous robotic systems are you have to see in a 3D view inside the box so that your neck will be inside. Here it is open robotic arm. That means console is open. It is a 3D vision. Actually you have to wear the glasses like this, which are detected by the detector here. Once you see the front, immediately you will see the 3D vision here. You all know that in 3D vision, like in a movie, where you will see closely the organs as well as the depth perception will be there. So after wearing these glasses, what we have to do is, there is a system here. Everybody will be interested about this system. First we have to know that they have introduced this arm rest for doing the surgery, so that at my level I can come here, I can come front also, I can sit on the back and then do like this. Either way it is okay. This is the first thing. Second thing, they have given an advanced system like in any advanced system of a car, where this entire system can move. For example, for my height, if this screen is at the top, if you press this down and up, it will move up and down. Same thing, entire thing can come. I have a foot switches here. These foot switches can come front and back, so that I need not go very front like this. This will be obstructing. This will be holding part. Similarly, they have up and down this the entire clutch and up it can go, so that tall person and short person can put their can rest their foot comfortably on these 6 pedals. Coming to the part of this system, the most important system is there is hand control system. Like this it will come. This is the hand control system, whereas foot control systems are there. On the left side, master clutch is there. When master clutch, if you press, everything stops. That means surgery in the form of instruments, it stops. You cannot perform surgery. Then why master clutch means to adjust all this. You wanted to keep like this, you wanted to keep like this. Everybody wants to keep like this. So when master clutch is there, surgery will not happen. Only thing is that you can rest like this and you can put like this hand comfortably. When master clutch is released, your hand movements will be acting. For example, during the surgery, you are by chance like this, you cannot operate like this. When you press the master clutch, entire surgery will stop, instruments will not move, then you will come and keep rest like this, then you can do the surgery. This is the most important part. But at the same time, the company has given 2 switches on the hand also. If you press 2 switches, completely the instruments will stop. These are called clutch at the hand level. This is the master clutch at the level of this thing. When master clutch is pressed, no instrument including the camera may not move. But in the hand instrument, if you do like this, it will stop. Second, coming to the foot control below, you have here camera control. For example, if you want to go nearer to the camera, what we think is like this, but opposite it is there. If you go like this, it will come nearer. If you come like this, it will go far. If you go away, camera will come nearer. If you go front, camera will go back. This is the second point. Now third point is, there are 4 pedals which are coagulation, right, left, cutting and cutting, right, left. You have a left arm, you have right arm. That means any surgeon will operate with the left hand and right hand. So with the left hand you will rotate, right hand you will rotate, left hand up, right hand down. Both can be done. When you are operating, you will use the current to cut the tissue. So that cutting is right side this cutting, this is left side cutting, this is right side coagulation when you want to burn, this is left side coagulation. This all will be attached to the cautery machine. Any cautery will do, they will have a connection which we will show. Now coming to the, everybody's interest is how these handles are moved. When you put like this master clutch and put it, it will not function. That means machine is at rest. You cannot do any movement. When you put the clutch, when you take it out, it will release. Now after the command is given at this computer by the service engineer or by the technician or by the surgeon, there are different arms. This is actually, this robo is 4 arms are there. You can see 4 arms there. They are called the patient side cart. This patient side cart is easily movable with motorized control. It is heavy. At the moment it is heavy. In future it may decrease in size. They come to the patient as arms. These 3 and 1 there, 4 arms. These will come to the patient. When they come in, right and left hand is the right and left arms, whereas camera is in the center. Camera movement is this, whereas hand movement are this. For camera movement we will use this, for hand movement we will use like this. Whatever movement you do there, it will happen inside, filtering the tremors. Now coming to the clutch, already I mentioned you should not press the clutch. These 2, the black ones which are present, if you press, instrument will close. That means all the instruments are open. All the instruments are open. When you press actively, they will close. If you press half, they will close half. If you press full, full. If you press very full, they may tightly close, then it is not good. So you should know how softly handle these fingers. You should not use this. Sometimes this may not be given in the hand and these things also. So when rest of the things is nothing in this except adjusting this table, adjusting this foot pedal and this. When the surgery goes in such a way that you are going away and touching this, when you are going away and touching this, master clutch you press, you come to the neutral position, then start again surgery. The instruments inside will not move. Only this will move, so that you can start fresh surgery from there. That means when the instruments are clashing, here you can push master clutch and go away, come to neutral position and then start the surgery. When instruments are too much inside, by chance if you wanted to withdraw, put master clutch, go inside, release the master clutch and withdraw the instrument. This is the common problem I faced during the initial phase of my practice, that both arms have gone inside. Then how to get back? If you want to get back, they won't come because here you are touching. Then how to do? Master clutch, you go completely inside, release master clutch and then bring back. Instruments also will come back. Similarly, if the instruments are very nearer to you, master clutch, you bring very close like this and then release and then go further. That means you have to do opposite. If the instrument is too much inside, you also go more inside and then bring outside. While going in, you have to put master clutch. While coming out, you have to release the master clutch. This is the most important point. If you know this, 90%, that means whenever camera you wanted to bring close, you have to go away. Whenever you want to bring the camera away, you have to come close, opposite. So next, coming to the, when I don't want to do surgery, when I want to stand, master clutch you press, you keep it like this, you can get up now, you cannot do surgery. These goggles, when you see front only, they will recognize. If you see side, they will not recognize. Coming to the SSi Mantra controls, we have here the CLR fault e-stop and on and off is there. This is nothing but mesh on and off. This is the main important thing. Whenever it is see, enable, lock, enable, lock, enable, lock, enable, lock, 4 controls are there. Total system left and right also is given here. This I am not going into the details because this is more easy daily. Whatever the mechanism you are using, you have to learn like this. Then it automatically on. If you off, it will off like this. This is not a big thing. Coming to the vision card. This is the central brain of the robo. That means this gets connected to the plug system there. Entire electricity comes to this. This is the crucial brain of the robotic system, that is called vision card. There is an UPS in which the current comes, UPS gets activated. Till the UPS get activated, you should not do the surgery. This UPS is only when the current goes, you have time to switch off the machine and then on the generator. Of course, generator is must to do these type of these surgeries. Coming to the various types of these things, if you see here, this is the Olympus 3D camera which comes along with the mission. This is a 3D system. This is a 3D. This is also 3D. Unless you wear the glass, you cannot. But if you want to record with cell phone, you can put in 2D mode also here. If you put in 2D mode, you will see in 2D mode. But nobody likes to see that in 2D mode. Similarly, we have a cautery mission also which is attachable to this. This is a storage system. Lot of TB storage you can store and get from the pen drive. Coming to the, this is a Olympus HD system where the head will be connected here. Next, coming to these 3, these are very important. 4 patient side cords will be connected to the central cart, this vision cart, through this wire. They are protected. One should be careful. They are given enough length so that with this length they can come to the patient. Now coming to the patient side cart. This is the patient side cart which is very important. For example, if the patient is sleeping here, come on, somebody can sleep and then it has a movement. This is not a big thing. You can hold and move like this. This is not a big thing. You can move completely like this. And another hole is here. If you press, see, you can press up and down so that this instrument will go inside the body by pulling these 2 outside, and you insert through this, and through this you will insert. So you will insert like this, and then it cannot be inserted now. Then this is a scissor. It will rotate in all the directions here. This is a scissor. Based on the control on this will rotate, and this also will rotate. You can see all the rotating knobs here. With this rotating knobs, that will rotate. You can see here it is rotating. It is rotating like that. Various angles we can be, all 7 angles inside the robo advantages we can get. That means this is the hand of the robo. This is the hand. Once it is docked here, if you want to go inside and outside, if you press the button once here, it can come inside, it can go outside. If you press button continuously, you can move a little bit this. You can move little bit this. Now at the same time, this also, it is coming like this. See, you can move this much. Wherever you want to move, there is an angle here. it should not be straight, they say. This all we have to learn. So when you park, it should be perpendicular like this. Like this you will park. When you get to the patient, there will be some angle. For example, if it is the patient, it is going inside. So when you want to do that, you can do like this, you can do like this. Ultimately, this instrument will go inside through this to the patient body, so that you can do the surgery. The most important thing which we have to remember here is, now I am keeping by the side of this patient. Whenever the patient is lying here, for example, if the patient is lying here, can I have one pen please? When the patient is lying here, the important difference between the, I don't mind drawing on this. This is the patient, this is the patient, this is the head end, this is the foot end, this is the umbilicus. When you wanted to do any kidney surgery here, one type of system will be there. When you wanted to do uterus or prostate, one type will be there. When you wanted to operate on the esophagus, that is different. When you want to operate here, on the other kidney is different. In laparoscopy, when you put the ports, we put 4 finger bits above, and then we make a azimuth as well as the 90 degrees angle. But in robotic, it will not apply that. All the robotic arms will come exactly opposite your surgeon. They will stand here, and their arms, normally surgeon will stand here, assistants will stand here. In robotic, all robotic arms will stand on the side of the surgery, where, and they will come and they go inside, and that control will operate. For that, this big arm, when it comes straight, it is camera, right side is the right arm, left side is the left arm. These 3 will stand here. They should not clash. That's why whenever you decide the camera port, which is the mid-clavicular line, in the mid-clavicular line, below the subcostal, first port will be there. From there, minimum 8 cm gap should be there. In laparoscopic surgery, we see according to our height. Here patient is not standing. He needs 8 to 10 cm gap. Now 8 cm gap, one port is there. One more port, 8 to 10 cm, a little below this line will be there, so that they won't clash. Other port, if you want to retract the kidney, if you want to retract liver, anything, you can come from here. How it will be? Equal distance from these 2, so that it will be like a jig-jog, so that they will not get clashed. So umbilical port above 4, wherever you want to put lateral rectus line for the kidney surgery, adrenal surgery. Here, for example, if you wanted to do cholecystectomy, which is not my field, I have observed, I am telling that the ports will be horizontal like this, not like opposite side will go, center you will go here around the umbilicus, opposite 10 cm, opposite 10 cm in one line, so that they all will concentrate on the, then all the arms will come here, all the arms come here, wherever the gallbladder is there, that side. So central arm will be this same position, one arm here, one arm here. Coming to the pelvic surgery, hysterectomy, the radical prostatectomy, radical cystectomy, the central arm will be all the 3. This is the umbilical port, one 10 cm here, one 10 cm, horizontal line almost, and side ports you can use for the 4th arm. Where they come from? In between the legs. In between the legs, one port will come. Right side leg, one port will come. Left side leg, one port will come. All will go inside like this. They all will operate like this. Inside they will be operating like this. Assistant will be standing here, seeing the car, and he will be assisting through the side ports, left iliac fossa, right iliac fossa below, and he will retract. If you want extra, that 4th arm can come here by this side, and can it hold the uterus up, it can hold the bladder up, anything, it will fix. For that, there is a side button here. If you press this button, your left hand it gets freezed. This is the button, S button. This S button, if you press, automatically the one which is using will stop, and it will switch over to the other arm. This is the most important thing. Now coming to the, what is the advantage of this? When you do robotic surgery, you may put, normally laparoscopic surgery destructive, there is no problem. But in robotic surgery, when deep cavities are there, For example, if it is an adrenal gland, if it is a deeply situated uterine fibroid, or if it is radical prostate or radical cystectomy, when lot of suturing is there, for example, augmentation cystoplasty, for example, pyeloplasty, for example, ureteric reimplantation, Boyari flap, you get tired by standing here and suturing like this, but whereas you sit there and do it. So to conclude, this SSi Mantra robotic system, which is invented by Indian doctor Sudhir Srivatsava sir, made it available. First thing is that I could buy it. How I will utilize over a period of time, we will tell. Now how I am planning is, first of all, I have done one nephrectomy day before yesterday, one nephrectomy. Before that I studied all this. That's why I am making things to understand for the people. I am not experienced person. Over a period of time, I did 2 cases without any problem, to be honest, because I have 15 years of experience in laparoscopic surgery. With that experience, I have used this for nephrectomy, large kidney. I could retract with 2 arms only and go to the pedicle, and third person could clip it. For clipping, you need one assistant person. Similarly, yesterday I have done laparoscopic VVF repair, vesico-vaginal fistula. It is a complex surgery. You have to separate, you have to open the bladder, you have to see the vagina, you have to see the bladder, you have to separate them, and then you separate adequately, then you suture the vagina, you suture the bladder, then you put the omentum and suture it. I am sharing the videos. It could be done in 1 hour 50 minutes, which is normal laparoscopic time without any strain. That means technically we can do it with 1 week or 10 days of practice also if you have already laparoscopic skills. If you don't have laparoscopic skills, you have to go for 1 month or 10 hours of this thing. Service engineers will help and they will come and do it. This is done in any part of the robo, not only SSi Mantra. So last conclusion part, what surgeries it is very helpful. Number 1, radical prostatectomy for urologist. Number 2, partial nephrectomy for urologist. Number 3, radical cystectomy with intracorporeal neobladder. Number 4, radical cystectomy with ileal conduit. Number 5, hysterectomy. Lot of hysterectomies can be done. Number 6 is pyeloplasty. Number 7 is ureteric reimplantation. Number 7 is you can also utilize this in Whipple's operation where pancreatic cancer removed. Number 10 is hepatectomy. Whenever there is mass, you can use it. Nice coagulation you can use and cut the liver also. You can also, people are also using in various other surgeries like hernia, like cholecystectomy. All the laparoscopic surgeries in future, maybe because of these cost-effective robos. You never know, because it has surgeon comfort, it has 3D vision, it has high precision, suturing is easy, you need not get strained, and tremors are also filtered. These are all well-known facts. So in future, technology like SSi Mantra, if it is available to all the sectors, then doing surgery at lower cost, maybe a little extra than laparoscopic cost is possible, and in future at the laparoscopic cost is also possible when these instruments can be used again. One more advantage of SSi Mantra is the instrument, there is no limit for the time. If you are good in using the instrument, you can use 10 times, you can use 15 times, I can't say 100 times, but the instrument, if you are soft, you can use the hook. They are coming up with the harmonic also. Then same like laparoscopy you can use. After 30 cases you can change the harmonic. Maybe 10 cases you can change the harmonic. Caesar is the one thing which you have to use carefully. Otherwise hook and harmonic will make it more cost effective. If you don't have limit, why should there be limit if the instrument is functioning? Why should there be limit? If the instrument is nicely functioning, use it for 30 cases, no problem. It all depends on us. If you use roughly rotating like this, front and back clashing, it will break in 5 cases also. So it's our talent how to use this robotic machine. So my dear friends, this is not to promote no conflicts of interest. I have taken this robo after certain inquiry. It is my affordability. I could not afford costly robos. This I could afford at an individual level, being the MD of the 3 hospitals. With this robo, I want to continue the journey and make available all sectors of the population. All laparoscopic surgeries can be done by robo. Even if it is not complex, if you do at the same cost, patient will accept. That is the motto of this robotic surgery. Till now I could not buy. Now I could buy it after waiting 10 years of laparoscopic journey. I have to unlearn and then relearn, unlearn my laparoscopic skills, learn robotic and then relearn the robotic surgery, which is the future in laparoscopic surgeries. Not only this, in throat also they are using In the neck also they are using, in bypass surgery also they are using, everywhere wherever your hands are there, robot may be there. Future is all technology. So we have to update the technology, we have to go with technology and do best service to the patient. Thank you. Warm regards from Preeti Urology and Kidney Hospitals, Hyderabad. Thank you very much.